Osteoarthritis of knee joint. So, arthritis as such means loss of cartilage. Osteoarthritis is a condition where cartilage is lost because of various mechanical factors and certain biochemical changes that are happening in the knee. Now, what exactly, before we answer on such a question, what is osteoarthritis, we should know that every major joint in our body is covered by a layer on the surfaces of the bone which articulate. So the thigh bone and the leg bone connect together, and the lower end of the bones are covered with a structure which is called as cartilage. And the cartilage is basically does not have any blood supply. It is such a beautiful structure that the friction between two surfaces of cartilage while they move is less friction than that of two pieces of ice sliding on each other. That is around 1,000 times less. And body is made up of this cartilage, and the cartilage is largely permanent tissue. Means it will, once it is damaged, it is a permanent damage. That is a disadvantage. But then it is such a viable tissue that if we take care of our body weight and take care of injuries that happen during sports, and if we take care of our alignment, the cartilage works till 70 to 80 years of age. Now, loss of this cartilage, where the bone loses the cartilage covering and bone starts rubbing against each other, that is called as osteoarthritis. And this gradual rubbing of the cartilage that happens with time is a stage by stage it goes. So for example, when the stage 1 arthritis we call, it is around 25% loss of the cartilage of whatever is available. When 50% is gone, it's called stage 2. When 75% is gone, it's stage 3. And when it is bone to bone, it is called stage 4 arthritis. So cartilage damage happens over a time. For it is very safe to say that a person who gets early osteoarthritis, by the time they become severe osteoarthritis, it takes a time of minimum 5 to 10 years. And there will be a lot of time when you can modify the disease and not allow a rapid progression of this osteoarthritis. And that is where osteoarthritis can be intervened. Also, one most important thing which we have to remember about osteoarthritis is, in osteoarthritis, it is not just mechanical changes of body weight or muscle power alone, but also a lot of chemical reactions which are happening inside the joint. Just like we deposit money every month to the bank and take money from the bank, and if we deposit more than what we take out, there is an accumulation of money. Similarly, in the knee joint, every single day there is a little bit of breakdown of the joint and little bit of deposition of the joint surface. When the breakdown becomes little more than the deposition, then the wear and tear starts. Somewhere around 40, the wear and tear component or the removal component becomes more than the deposition. We call this as anabolism and catabolism in medical terms. Anabolism is deposition and catabolism is removal. Somewhere around 40 to 45, the catabolism becomes more. We need to be careful to prevent that catabolism from overtaking things. And that is where the role of various kind of knee conservation strategies and knee supplements come into play.